shouldn't be experiencing worse outcomes or face barriers just because they're part of a particular group. It also enables us to focus on the wider determinants of health, so like housing, employment, which of course are the main drivers of health. And the other factor is that addressing inequalities in outcomes and access and experience for people from ethnic minority backgrounds has benefits for everyone. So I'm going to take you through the findings of our report, looking at the mental health experiences of ethnic minorities in Wandsworth. But before that, we're just going to highlight the national statistics. So next slide, please. Okay. So you can see here the kind of stark inequalities really that exist within this space. So just to highlight some key statistics, so compared to white British people in the UK, Black people are 2 times more likely to have police involvement in inpatient admissions. They're 4.6 times more likely to be detained under the Mental Health Act and 4 times more likely to be subject to restrictive interventions. People from a Bangladeshi background are also 7% less likely to show improvement following treatment for anxiety and depression. So I'm sure many of you will already be quite aware of some of these statistics, but just want to highlight the inequalities that do exist. Next slide, please. So in writing with this report, we tried to speak to as many people as we possibly could. We spoke to mental health services and we spoke to people working in community organisations, and we gathered case studies of local residents and of people using our local services. And it was really important for us to write this report in people's own words. So what we've done is, alongside the data, we've presented a number of case studies and quotes. And as well as highlighting the inequalities experienced by ethnic minorities in relation to their mental health, we really wanted this report to highlight the excellent work that is being done within our community organisations to support the mental health of people from ethnic minority groups. Next slide, please. So the report investigates 5 themes, and these were identified as key issues facing people from ethnic minority backgrounds in relation to their mental health. And these came out of the mental health needs assessment that we did that I mentioned earlier. So the 5 themes that we'll be covering are the impact of socioeconomic inequalities on mental health, the impact of COVID-19 on mental health, cultural understanding and stigma in relation to mental health, racism and racial discrimination in mental health services, and community-based culturally appropriate mental health support. Next slide, please. So looking at our first theme, we know that there is a strong systemic relationship between mental health and deprivation, and that improving people's living situations is key to improving mental health outcomes. Next slide, please. So if we're looking at the links between poverty, mental health and ethnicity, adults in the poorest 20% of the UK population are twice as likely to develop a mental health problem compared with the average in the population. And people from Black, Asian and mixed groups in the UK are 2.5 times more likely to be in relative poverty than people from white groups. Next slide, please. So within our conversations with regards to the socioeconomic challenges that residents in the borough were facing, we heard repeatedly about the challenges that people experienced in relation to housing, including quote, living in substandard, frequently mouldy property, also rising house prices and people being housed out of the borough. On this slide is a case study from a service user of Family Action, Well Family, which is a food bank service that provides emotional and practical support to clients of the Wandsworth Food Bank. This service user was a female between the ages of 20 and 30. She was of mixed ethnicity. And she talks about the number of issues that she was experiencing with housing, a rent increase that she was unable to afford, um, a, a, a flat that was in very poor repair, that the landlord was refusing to address. And she felt that she was experiencing racism in this particular scenario. And this was having a significant impact on her mental health. Next slide, please. So the links that we know exist between socioeconomic deprivation, ethnicity, and mental health are increasingly alarming in the context of the cost of living crisis. Early analysis has shown that ethnic minority households are estimated to experience a 32% greater increase in cost of living compared with white households. And the pressures of cost of living were frequently mentioned when we had conversation with stakeholders for this report. It was felt to be putting pressure on everyone and having a significant impact on their mental health. Next slide, please. So while this was expected to increase mental health need and demand on services, we were reminded by one provider that for people who are experiencing the greatest stresses as a result of the cost of living, they're also going to be facing the greatest barriers to accessing support. And I think the quote on this slide really sums things up very, very well. So they said to us, people don't tend to engage with psychological therapy if their immediate worries are putting food on the table. So it just shows how these factors can be a significant barrier to people accessing the mental health support that they need. And obviously, then how that can escalate in terms of poor mental health. Next slide, please. So we heard how local services have responded to this crisis by increasing the accessibility of mental health support for these particular groups of people. So for example, mental health support workers have been located within a local food bank. We heard about the work that Family Action, the Well Family Services are doing. They provide 2 sessions of emotional and practical support to clients who are using the Wandsworth Food Bank at the Trussell Trust and Earlsfield. And representatives of the service told us about the level of mental distress that they are seeing amongst the increasing number of people who are using their food banks. And they felt that the location of their mental health support services within the food bank was critical to gaining engagement from these groups. Next slide, please. Okay, so the second theme is the impact of the COVID-19 pandemic on mental health. Now, we're all very aware that COVID-19 disproportionately impacted people from ethnic minority groups. And from the start of the pandemic, people from ethnic minorities faced an increased risk of contracting COVID. They experienced more severe symptoms and higher rates of death. And these disproportionate impacts were found to be linked to decades of structural injustice and discrimination. Next slide, please. And these experiences had a significant impact on people's mental health. We spoke to one of the GPs in Wandsworth who said to us that people from ethnic minority backgrounds were more exposed to COVID and they were more worried about COVID. And when they did get COVID, they developed anxiety, especially when they saw their community was partly decimated by COVID. Next slide, please. And unsurprisingly, people from ethnic minority backgrounds experienced increased mental health needs during the pandemic. From the start, men from ethnic minority backgrounds reported greater declines in their mental health compared with white British men, and Bangladeshi and Pakistani men reported the worst declines. We didn't see a similar disparity between white British and ethnic minority women, but women overall reported greater declines in their mental health compared with men. And children and young people from ethnic minority groups were also negatively impacted. Self-reports of depression to COOth, which is an online support system for mental health, increased by 9.2% among children and young people from ethnic minority backgrounds, whereas self-reports of depression from children from white backgrounds decreased by 16.2%. Next slide, please. And within our conversations, one of the things that was frequently highlighted as negatively impacting ethnic minority mental health was the disruption to communities and to community practices during the height of the COVID-19 pandemic. So, for example, we heard about the impact of not being able to perform particular cultural rituals around death, or being able to visit families in hospital. One of the examples that was given to us was not being able to perform community practices such as Nine Nights, which is popular amongst the Black Caribbean population. And not being able to perform these practices was felt to really disrupt the grieving process for many people, and subsequently had a negative impact on their mental health. Okay. I'm going to hand over to Melissa now, who's going to take you through the rest of the presentation.
Thank you so much, Natalie. And so I'm going to start by bringing us on to the third theme of the report, which looked at cultural understandings and stigma of mental health. So different communities will understand and talk about mental health in various ways. In some communities, mental health issues will rarely be spoken about and will be considered with a huge amount of stigma. So, for example, as was explained to us by a representative of the Polish community, in the UK, when you talk about mental health, you could talk about stress. Back in Poland, for example, if someone says, "Oh, you've got mental health issues," it means you would be locked up in hospital. And we also heard about the stigma of mental health within Black, African and Caribbean communities. One focus group participant explained to us that there is a huge amount of stigma. My own family would not accept that I had mental health challenges. They did not understand it, and I don't think that they were interested in understanding it. They just found it embarrassing. There was no support at all. And as these two case studies demonstrate to us, how mental health is understood can profoundly influence how a person responds to their own or someone else's mental health. It can determine where a person seeks help for their mental health, whether this be with a health professional, with family, with friends, and indeed if they do even seek help for their mental health. And not seeking help for mental health can have long-term impacts. It can increase the likelihood that a person will first encounter mental health services in a point of crisis. And it will also increase the likelihood that there will be police involvement in their mental health journey. And a further theme that was routinely highlighted within our conversations, and perhaps the biggest theme that was highlighted to us, was racism and racial discrimination within mental health services experienced by ethnic minority people. So just to reiterate some key statistics, Black people are 4.6 times more likely to be detained under the Mental Health Act, 10 times more likely to be subject to a community treatment order, 2 times more likely to have police involvement in inpatient admissions, and 4 times more likely to be subject to restrictive interventions compared to white people. And nationally, we've seen these trends have shown a worrying decline over the past few years. Since 2016/17, the rate by which Black people have been subject to restrictive interventions nationally has increased by 104%. And whilst the rate by which white people have been subject to restrictive interventions has also increased over this period, this has only been by a much more marginal 30%. And similarly, the rate at which Black people in the UK have been subject to community treatment orders has risen to 8 to 11 times higher than white people over the past 5 years. And when we carried out our mental health needs assessment in Wandsworth, we found that these trends were represented in our borough. We found that Black people were severely overrepresented in referrals to South West London St George's crisis and inpatient services, particularly amongst referrals to the psychiatric intensive care unit, to which Black people made up half of referrals between 2018/19 and 2021/22. And this is more than 4 times the Black population in Wandsworth. We also found that Black people were overrepresented amongst those being assessed for detention under the Mental Health Act by an approved mental health professional between 2020 and 2022. And when we spoke to partners for this report, we heard about how this overrepresentation in services creates fear and mistrust towards mental health services for people from ethnic minority communities, and how this in turn makes them more reluctant to seek help for their mental health concerns. So as was explained to us by one service provider, we hear that fear that if I turn up and I'm a little chaotic and I'm a bit unwell, they're going to detain me, that I've been abused by the system my whole life. So when people feel that things are going a little wrong, they then withdraw from services because their experiences are that as soon as you show a little bit of a sign of relapse, we're going to try and bring you into hospital. And as a result of this, opportunities for early intervention with mental health support are often missed, which means that a person is more likely to confront a mental health crisis unsupported and have their first contact with police rather than healthcare. This begins a different relationship with mental health services, which paradoxically is actually more likely to exacerbate and perpetuate the cycle of mistrust that people from ethnic minority backgrounds have in institutions. And we heard about the impact of this mistrust and delays to seeking support from a representative at Cainrose. And the representative explained to us that Black people often come to the wards and it is far too late for them. They've gone too far the other side. When we do go in and see them, they are not sure who we are and need a lot of support. Usually there's some kind of activity to engage them first in order to gain trust. So sometimes we paint people's nails or give them a hand massage or plait someone's hair first, that sort of thing. It needs to be something tangible to encourage them to open up and speak. And Cainrose was an organisation that we frequently receive praise for within our conversations. Cainrose is a local service which provides peer support on inpatient wards with the aim to improve mental health care in inpatient settings, particularly for ethnic minority people. And partners particularly reflected on the fact that the service is led by peer support workers, that they themselves have had previous experience of mental health and being on an inpatient ward. This was felt to be hugely beneficial for building a level of trust and understanding between the inpatient and the service user, and therein supporting inpatients to feel less alone in their experiences. And we heard how this led to reduced rates of ward readmission for service users who have been supported by the service for over the past 4 to 5 years. And when we went on to having discussions with partners about how to improve outcomes with mental health for ethnic minority people, partners repeatedly felt that mental health services need to be delivered in a community-based and culturally appropriate manner. Because as was explained to us by one partner, we can't have good mental health services in this country if we do not have good engagement in communities. And one of the challenges that was routinely discussed in conversations was the need to diversify the upper tiers of the mental health workforce. Whilst it was recognised that a lot of the mental health workforce is actually ethnically diverse, it was felt this was not reflected amongst those who held decision-making powers. And one service provider described to us how this lack of ethnic diversity increases the sense of disempowerment that ethnic minority people experience. They told us that one of the main difficulties is the sense of disempowerment. Once they are identified as having a mental health problem, their life starts to be managed by other people and not by themselves. And in the case of Black or minority ethnic people, that sense of disempowerment is increased by the fact that the people with the real power, the doctors and the health managers, are mostly white. But we were also reminded that efforts to improve the cultural competency of services needs to be multifaceted. So in addition to diversifying the mental health workforce, adjustments were also felt to be needed to the location of mental health services, as well as the type of support or intervention that was provided to individual service users. It was emphasised that ethnic minority service users must play a central role in redesigning and delivering support and services, as they are the people who are best placed to determine how outcomes can be improved for their communities. And partners highlighted to us some of the services that are leading the way with this work in the borough of Wandsworth. For example, we heard about the work underway to deliver cultural competency training to therapists at Wandsworth, which is an NHS talking therapy service for the treatment of anxiety and depression. And this training has involved supporting therapists to be able to adapt their interventions to individual service user needs and to proactively start conversations on service users' experiences of racism and discrimination. And another service that we had repeated praise for was the work of MHIP, which stands for the Ethnic Minority Health Improvement Project. And MHIP is a local organisation which provides a range of interventions to reduce inequalities in access, experience and outcome within mental health services for ethnic minority people. And partners particularly praised how the interventions that MHIP run have been co-produced with service users. For example, we heard about the really exciting work underway to develop the MHIP Home Placement Project, which is a service that adapts the foster care model to mental health, where service users at risk of being sectioned under the Mental Health Act are provided with a carer or family from the local community to provide mental health support in a way that is culturally competent. As was explained to us by a representative of MHIP, it would be moving away from placing someone on a very white, clinical, sterile environment, but placing them in the home where there is warmth, there is love, there is care, there is nurture, and where cultural needs are met. And I just wanted to conclude this report by just really reiterating the purpose of this report. This report is intended as a call to action, and it's an opportunity to advocate for change. When reading the report, we're asking people to think about what it means to ensure that mental health services are anti-racist, that they deliver culturally competent care. We're asking people to think about what it means to acknowledge and challenge unconscious biases and to develop policies and practices that do not discriminate. Thank you so much for your time this morning. Natalie and I are both very happy to take any questions if you have